Have you ever wondered what it would be like if the reality you experience daily differed from that of the person beside you? Welcome to the intricate realm of schizophrenia, a mental disorder that alters the way a person perceives their reality. Contrary to popular belief, schizophrenia isn't about having a split personality or multiple personalities, but rather a condition that can cause a person to lose touch with reality. It can result in hallucinations, delusions, and extremely disordered thought processes and behavior, severely impeding day-to-day functioning. Previously, schizophrenia was divided into specific subtypes, but this practice has been abandoned by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. However, these historical classifications continue to be significant for clinical and research reasons. These subtypes are paranoid schizophrenia, characterized by strong delusions and hallucinations; disorganized schizophrenia, known for disorganized thought, speech, and behavior; catatonic schizophrenia, which involves movement disorders; residual schizophrenia, which refers to those who have experienced a serious episode of schizophrenia but currently have milder symptoms; and undifferentiated schizophrenia, applied when a person doesn't fit neatly into a specific subtype. It's crucial to understand that these subtypes are not always clearly defined. Over time, individuals may display a mix of symptoms from different subtypes. This fluidity underscores the complexity and individuality of each person's experience with schizophrenia. The DSM-5 now highlights a spectrum approach, assessing symptoms and their severity along a continuum rather than rigidly categorizing individuals into discrete subtypes. This method offers a more thorough and personalized understanding of the condition, acknowledging that no two individuals with schizophrenia will have identical experiences. In the upcoming discussion, we will explore the subtypes of schizophrenia, offering a detailed understanding of this intricate disorder. With a better understanding of these subtypes, we can better comprehend the various manifestations of schizophrenia and devise more effective treatment strategies for those living with this condition. Let's delve deeper into understanding schizophrenia, a mental disorder characterized by prominent hallucinations, delusions, and disorganized speech and behavior. This aspect of the mental health spectrum is intriguing, as people with schizophrenia often maintain a considerable degree of their cognitive functions. When it comes to schizophrenia, hallucinations and delusions take center stage. These aren't mere imaginative thoughts, these are sensory experiences that are incredibly real for those undergoing them. Hallucinations can engage any of the senses, with auditory ones being most prevalent, where people might hear voices that are inaudible to others. Delusions, on the contrary, are unyielding beliefs that persist in spite of undeniable evidence proving otherwise. These could vary from grandiose delusions, where people presume they possess unique powers or status, to persecutory delusions, wherein they sense they are being targeted or conspired against. Remember, these hallucinations and delusions aren't capricious or transitory. They frequently form a coherent and intricate alternate reality is quite believable to the person experiencing them. Despite these overpowering experiences, one might be astonished to learn how well the cognitive functions of individuals with schizophrenia are preserved. Their thought process might be lucid and systematic. They often express their ideas effectively, and their memory and concentration may be relatively unaffected. Emotionally, people with schizophrenia might appear comparatively steady. They are less inclined to display the emotional dullness or inappropriate affect that typifies other mental disorders. Nonetheless, their emotions are frequently eclipsed by the potency of their delusions and hallucinations. It's vital to bear in mind that these descriptions aren't definitive. Mental health conditions are a spectrum, and people don't necessarily align neatly into one category or another. Symptoms can intermingle, and severity varies from person to person. While their perception of reality might be skewed by delusions and hallucinations, People with schizophrenia often preserve a noteworthy quantity of their cognitive abilities. This distinctive amalgamation of symptoms renders schizophrenia a multifaceted and captivating sphere in the field of psychiatry. Next, we explore disorganized schizophrenia, a subtype characterized by disorganization in thought, speech, and behavior. This subtype, also known as hebephrenic schizophrenia, presents a unique set of challenges in understanding and treatment. Let's delve into the symptoms. Disorganized schizophrenia is marked by the presence of disordered thoughts and speech, often making it difficult for the individual to maintain a coherent conversation. They might express ideas in a haphazard way, jumping from one topic to another without clear connections. Behavior, too, is frequently erratic and unpredictable. Individuals may exhibit inappropriate actions such as laughing at a sad event or crying without an apparent reason. This unpredictability can make it challenging to establish routine or engage in goal-oriented tasks, which are often essential aspects of daily living. Another key symptom is the exhibition of inappropriate emotions. For example, an individual might giggle or laugh in situations where it's socially unacceptable or simply doesn't fit the context. This emotional incongruence can make social interactions challenging and often isolates the individual from their social circle. Additionally, people with disorganized schizophrenia may struggle with goal-oriented activities, from simple tasks such as getting dressed to more complex ones like holding down a job. This difficulty often stems from the disorganized thinking that characterizes this subtype, making it hard to plan and execute tasks in a logical sequence. Lastly, this subtype is often marked by unpredictable or inappropriate behavior. This could range from acting childlike to exhibiting agitation or aggression without a clear trigger. As a result, individuals with disorganized schizophrenia often need a supportive and structured environment to manage their symptoms effectively. It's important to remember that while these symptoms are common in disorganized schizophrenia, they can also occur in other subtypes. Each individual's experience with this disorder is unique, and symptoms can overlap across different subtypes. In summary, disorganized schizophrenia is characterized by disorganized thinking, speech and behavior, inappropriate emotions, difficulties with goal-oriented activities, and unpredictable or inappropriate behavior. Understanding these symptoms can help clinicians and caregivers provide tailored support to those living with this subtype of schizophrenia. Disorganized schizophrenia can present a challenge due to the unpredictability of the individual's behavior and emotions. Now, let us delve into catatonic schizophrenia, marked by its distinctive disturbances in movement. Catatonic schizophrenia is a historically recognized subtype, largely characterized by striking abnormalities in motor behavior. This could manifest as a dramatic decrease in activity, where the individual may become virtually motionless, or it could swing to the other extreme with excessive, purposeless movement. This unusual behavior can be particularly jarring, making it one of the more recognizable forms of schizophrenia. Unpredictable changes in movement are a hallmark of this subtype. One moment, an individual might be completely unresponsive, displaying what professionals refer to as catatonic stupor. They might be still for long periods, seemingly oblivious to their surroundings. They may resist efforts to be moved or even fail to react to loud noises or sudden threats. On the flip side, the same individual could exhibit catatonic excitement, a state of hyperactivity characterized by random and frenzied movements. These can be so frenetic that they become dangerous to the individual or others around them. Another peculiar symptom of catatonic schizophrenia is the tendency to hold unusual postures, often defying the laws of comfort or even gravity. This is known as posturing or catalepsy. They may also display waxy flexibility, where they maintain positions after being placed in them by someone else, like a wax figure. Yet another intriguing manifestation is echopraxia and echolalia. The former refers to the mimicking of movements of others, while the latter is the repetition of words or phrases. These symptoms underscore the profound impact catatonic schizophrenia can have on an individual's motor control and responsiveness. In the face of these extreme physical manifestations, it's crucial to remember that catatonic schizophrenia, like all types of schizophrenia, is a severe and debilitating mental disorder that requires comprehensive treatment and care. The bizarre motor symptoms are often a visible testament to the invisible mental struggles these individuals grapple with daily. Catatonic schizophrenia can be particularly alarming due to its extreme physical manifestations. With understanding and compassion, we can strive to support those living with this challenging condition. Lastly, we will examine residual and undifferentiated schizophrenia, subtypes that represent milder or undefined manifestations of this disorder. Moving on to residual schizophrenia, this subtype typically describes individuals who have previously experienced a major episode of schizophrenia. The term residual refers to the presence of lingering or residual symptoms that persist following a more intense period of the disorder. These symptoms can be of a lower intensity and might include things like odd beliefs, unusual perceptual experiences, or mild forms of disorganized speech. The person might be described as being in a more stable phase of the disorder, yet they still exhibit some symptoms, albeit at a reduced severity. Now, let's turn our attention to undifferentiated schizophrenia. This is a somewhat catch-all category used when a person doesn't fit neatly into any specific subtype of schizophrenia, yet still displays symptoms characteristic of the disorder. These individuals may present a mixed picture, with symptoms varying over time and not clearly aligning with the paranoid, disorganized, catatonic, or residual subtypes. They might experience delusions, hallucinations, disorganized speech or behavior, and negative symptoms like emotional flatness or apathy, but not consistently enough or in a pattern that fits the other subtypes. It's important to note that these classifications are not mutually exclusive. A person might transition between different subtypes over time or display a combination of symptoms from different subtypes. This fluidity is reflective of the complex and multifaceted nature of schizophrenia as a disorder. Moreover, the most recent edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, has moved away from these rigid subtype classifications, preferring a spectrum approach. This approach considers the symptoms and their severity along a continuum, providing a more nuanced understanding of this complex disorder. In conclusion, these subtypes, residual and undifferentiated schizophrenia, underscore the broad spectrum of schizophrenia where symptoms can vary in intensity and type. They remind us that schizophrenia is not a one-size-fits-all diagnosis, but a complex interplay of symptoms that can change over time and differ from person to person. These subtypes remind us of the broad spectrum of schizophrenia, where symptoms can vary in intensity and type. Having explored the subtypes of schizophrenia, it's important to recognize that these are not always clearly distinct. With this in mind, let's recap the key points. Schizophrenia is a complex mental disorder, historically divided into subtypes such as paranoid, disorganized, catatonic, residual, and undifferentiated schizophrenia. Each presents unique symptoms, yet they share a common thread of disconnection from reality. Paranoid schizophrenia is characterized by prominent delusions and hallucinations, while disorganized schizophrenia is marked by disorganized thinking, speech, and behavior. Catatonic schizophrenia involves disturbances in movement, from excessive motor activity to decreased responsiveness. Residual schizophrenia describes individuals who, after a major episode, have entered a more stable phase with milder symptoms. Finally, undifferentiated schizophrenia is used when a person doesn't fit neatly into any specific subtype, but still displays symptoms of schizophrenia. Now let's move on to the DSM-5 spectrum approach. Unlike previous versions, the DSM-5 doesn't categorize schizophrenia into distinct subtypes. Instead, it emphasizes a spectrum approach, considering symptoms and their severity along a continuum. This approach acknowledges the fluidity of the disorder, as individuals might exhibit a combination of symptoms from different subtypes over time. To assist in remembering these criteria, let's use the mnemonic praise. P stands for positive symptoms, such as hallucinations, delusions, disorganized speech, and grossly disorganized or catatonic behavior. R refers to reality distortion, including a lack of insight into one's condition. A stands for affective flattening or alogia, representing diminished emotional expression or poverty of speech. I is for impaired functioning, marking significant social or occupational dysfunction. S signifies signs and symptoms present for a specific duration, with continuous signs of disturbance persisting for at least 6 months. And finally, E stands for exclusion of other causes, ensuring that the disturbance isn't attributable to substance use or another medical condition. Remember, in understanding schizophrenia, it's essential to consider the individual's unique symptoms and their severity, rather than attempting to fit them neatly into a specific subtype. Schizophrenia is a complex disorder with a wide spectrum of symptoms and manifestations. Indeed, we've journeyed through the labyrinth of this disorder, exploring its historical subtypes from paranoid to disorganized, catatonic to residual and undifferentiated schizophrenia. These categories, while no longer officially recognized in the DSM-5, remain crucial for clinical and research purposes. Remember, schizophrenia isn't a one-size-fits-all condition. It's a complex tapestry, woven with threads of varied symptoms, experiences, and manifestations. The mnemonic praise is a helpful tool to recall the criteria for diagnosis. As we navigate the evolving landscape of mental health, it's paramount to remember that understanding these subtypes contributes to a more nuanced perspective of the disorder. This knowledge is a potent weapon, enabling us to tailor treatments and therapies to the unique needs of each individual, thus enhancing their journey towards recovery. With a greater understanding of schizophrenia and its subtypes, we can work towards more effective and personalized treatment approaches for individuals living with this complex disorder.